So patients with acute back pain, they'll usually have a lot of problems with breathing just because of the acute pain. They'll have apical breathing and they'll not do some abdominal breathing. So it's very important, after educating, relaxing our patient, building a rapport, we can start using the table in order to restore a normal breathing pattern. So we can bring our patient down very gently without loading the spine too much, and we can talk about the normal breathing patterns. We can start opening up the intercostals, stretching a little bit. If we want to stretch the diaphragm, release the diaphragm, we can go down here and you can see the ribs coming up. We can also use some manual release techniques in order to release the diaphragm, and I would keep my hands here for a couple of minutes, and every time she breathes out, I add some more pressure, going deeper under the ribs. Of course, we would do that on both sides. And this releases tension. Of course, we know that the diaphragm is connected to the spine, and that normal diaphragm function will have some effect on the spine and the discus by adding some traction. And talking about traction, we can show you how we would do some traction here